Alright, so let's talk about this volume of distribution. So we remember that concentration is equal to mass over volume. And the concentration we always look at is the plasma concentration. And we say that's equal to the mass of drug absorbed divided by this thing called the volume of distribution. And so in the perfect world, this drug would distribute evenly in the intravascular space and the extravascular space. But that doesn't happen. And so when we get these variations, we need a way of describing what's going on. So we gave a certain dose of drug, the mass, and we noticed that the plasma concentration is not ideal. And so the way we describe that difference is with this term volume of distribution. Now remember, it's not a real volume. It's our way of saying, hey, if I didn't know any better, this plasma concentration isn't normal. So something must be up with the volume that this drug is distributing in. And so that's why we call it the apparent volume of distribution. Super huge, remember, apparent volume of distribution. And so you will never really calculate volume of distribution on your own clinically. It's something that's normally given to you. It's a constant. So the first thing I want you to remember here is that the volume of distribution is not a variable. Instead, it's an attribute of a drug. It's something that's given to you. If you look up information on the drug, it'll say what's the bioavailability, what is the volume of distribution, and it might say, what are the indications and standard dosages, yada, yada, yada. So it's an attribute of the drug in relation to the average healthy person. So what does attribute mean? Well, if you think of a person, right, what are attributes of a person? He's nice, he's friendly, he's tall, he's short, he's fat, he's skinny. Those are attributes. And just like that, we have attributes for drugs. It has a low bioavailability, high bioavailability. It's lipophilic, it's hydrophilic. It has a high volume of distribution, a low volume of distribution, whatever. Also remember this, that when it's measured experimentally, most of the time they use an average healthy person, and that's the volume of distribution that is published to you. So what it does is it tells us really where this drug likes to be. So drugs that like to stay in the plasma, well, in relation to the total body water, right? In relation to the total body water, the plasma concentration is much lower, right? Plasma, we say, it's about 2.5 liters. It's a little bit over 90% water, but the total body water is about 40 liters. So for drugs that like to stay in the plasma, well, it means it's distributing in a really small volume. And so when a drug has this attribute, we say it has a low volume of distribution. Conversely, if a drug likes to stay in the extravascular compartments, right, which have a larger volume, we say this has a high volume of distribution. So what are some ballpark numbers? Typically I say, if the volume of distribution is, let's say, less than 9 liters, and this is really ballpark, I would say it has a low volume of distribution. Whereas if a drug likes to stay in the extravascular space, it has a higher volume of distribution, I would say greater than 40 liters. Now you might say to me, but wait. You just told me the total body water is 40 liters. How can the volume that this drug distributes in be greater than 40 liters? And my response is, it's not a real volume, it's the apparent volume of distribution. Because if I was to rearrange this equation, and I say the volume of distribution is equal to the mass divided by the plasma concentration, if this drug is highly bound to, let's say it all goes into the fat extravascularly, and the plasma concentration is super low, I can get this apparent volume of distribution that is very high. I hope that makes sense. So how do we use volume of distribution clinically? Well, clinically, it helps us figure out how much total drug you need to give in order to reach a desired plasma concentration. So let's work that out really quick. So here is this equation that a lot of books use. The volume of distribution is equal to the amount of drug absorbed in the body divided by the plasma drug concentration. And really quick, if you give a drug IV, how much of that is absorbed? 100%. So you can kind of think of the amount of drug absorbed into the body as being equivalent to the amount of drug given IV, right? And if it's not given IV, then we have to factor in bioavailability. So if I'm trying to figure out this IV dosage, right, or the mass of the drug, the total mass, I would say, all right, the IV dose, aka the mass absorbed, is equal to the plasma concentration, the concentration in the plasma, times the volume of distribution. So I can just look at this and this will tell me a lot of things. If I have a certain desired plasma concentration, let's say 10 milligrams per liter, if a drug has a high volume of distribution, that means I have to give a larger dose. But if that drug has a lower volume of distribution, that means I can give a lower dose, right? So it's directly proportional to the amount of dose you want to give for a given plasma concentration. So what goes into the volume of distribution? How do we solve for it? Well, one thing is size. If a drug is really big, you tell me, does it like to stay in the plasma, or will it easily get out into the extravascular space? And so you should be saying, if the drug's really big, if the molecular weight is high, what does that mean? That means it's going to stay in the plasma, thus it has a low volume of distribution, low VD. What else? Well, we can say, does this drug like to bind to plasma proteins, or does it like to bind to extravascular proteins? And so here we write plasma protein binding or extravascular protein binding. If it's bound to plasma proteins, it's going to have a low volume of distribution, right? Low VD. Where if it's bound to extravascular proteins, right? If I measure the plasma concentration, it would be really low because very little of that drug's there, so I'd have a high volume of distribution. This would increase it. All right, what if it didn't bind to proteins? Let's say it bound to, got into fat, right? Or if it was really charged. So what am I talking about? I'm saying, is this drug hydrophilic or is it lipophilic? And so if a drug is lipophilic, if it binds into fat, well, we said fat was extravascular, that would be a high VD. If it was hydrophilic or really charged, I would say that's a low VD because it stays in the plasma. Now finally, here, remember I was saying it has to be the average healthy person. So what are examples when a person's not healthy? Well, one is, we said plasma protein binding. What if they're really protein deficient and they don't have that super abundant plasma protein called albumin, which a lot of drugs bind to? So I'm just going to make a little note here. Plasma protein, the one you should remember is albumin. Albumin. It is the most abundant protein in the body. And tons of stuff other than drugs just bind to it. Calcium binds to it. What else binds to it? Bilirubin binds to it. So that's one scenario if you're low plasma protein. What's another scenario? Well, remember that if these big drugs, they couldn't get out because they were too big. Well, what if we had increased capillary permeability? Well, then maybe the drugs that originally couldn't get out can now get out. And so when a person is, like I was saying before, in septic shock, that might affect the volume of distribution from what was originally given to you or what was stated. So all of these things here go into volume of distribution. These are all, things that components of it. And instead of thinking about these individually, we relate it to our core equation: concentration is equal to mass over volume. Here are some examples of the apparent volume of distribution, and I pulled this from Wikipedia. And the point is here so you can just see some numbers. Warfarin has a volume of distribution of 8 liters. So like I said before, we would say that's a low volume of distribution, and that means it's in the plasma. And the comments here are, this reflects a high degree of plasma protein binding. Here's ethanol, alcohol. Notice that the volume of distribution is about 30 liters. This is about equal to the total body water, which is about 40 liters. So what we say here is that ethanol kind of just freely goes through and it's distributed in the total body water. It goes from intravascular to extravascular, intracellular to extracellular. It distributes evenly. Now here's chloroquine, a famous drug that's been used to treat malaria. Look at this volume of distribution. It is 150,000 liters. And so what that means is that I give a certain dose and the plasma concentration is really low. Where did all that drug go? Well, here it says that it shows a highly lipophilic molecules which sequester into the body fat. So high volume of distribution means it's in the extravascular space. Finally, some experimental drug, volume of distribution of 8 liters, so we'd say that's low, and this is because it's a highly charged hydrophilic molecule. So just a last comment on another way to think about it before we get into some pictures to help you really remember what volume of distribution is. So, here's this particular scenario. I gave a certain amount of drug and the plasma concentration is really low. So it appears as if this drug distributed into a really, really large volume, right? And that would be the case for something like chloroquine. So let's do some pictures, because pictures are really what help you solidify things in your head and help you remember them. So here are some comparisons. So what we're going to do is say what happens when you have a low VD, high VD, whatever. So low volume of distribution. This right here is our vascular space. Here is our extravascular space. Vascular, extravascular. And so what we're going to do is just draw a little bit of drug. And so this right here represents the drug, and I marked it here. And so a low volume of distribution means the drug likes to stay in the vascular or extravascular. Here you say it. You got to be quick now. It means it's mostly in the vascular space. So some of this drug can be free, which is what this represents, and some of this drug, let's say, is bound to plasma proteins, and that's what I kind of drew in red here. And so the red is plasma protein binding. And so remember that only the free drug is, quote, active. This is the drug that can really bind to receptors, whereas drugs that are bound to plasma proteins, this is the bound drug, and we can say this is inactive. Just a word of the wise. So low VD, most of that drug's in the vascular space, and here we'll draw just 1 or 2 drug molecules in the extravascular space. Alright, so really quick now, you tell me, if I have a high volume of distribution, where's that drug going to be? Good. It's going to be in the extravascular space. So what are some examples of where it can be in the extravascular space? Well, it might bind to some proteins in the extravascular space. And like we said before, it can also get into the fat and muscle. So here we draw the fat and the muscle, and the green shows the drug is inside of there. And there also might be some free drug roaming around. Whereas if I was going to say what's going on here, right, very little drug. And so somewhere in between, I would say, here's our picture. I have some bound drug, I have some free drug. On the opposite side, I have maybe some bound drug and some free drug, and maybe, 1 or 2 is just getting into the fat or muscle. So here is kind of this in-between case. And typically when we're in between those numbers, we say, oh, it's, if it's closer to the 30-40 range, we say it's distributing into the total body water. So now you got the key terms down. And just to make sure you remember here, what is that main plasma protein that drugs like to bind to? That is albumin. And when we measure concentration, do we measure the extravascular concentration or the intravascular concentration to determine volume of distribution? Well, we measure the vascular, or what's going on in the plasma, right? So key points. So here's an important point, and it's a question that students commonly ask. They say to me, hey, a lot of drugs don't work in the plasma. They don't work in the blood. Like, we want drugs to, let's say, work in the work on the heart or work in the other places. So why do we care about the plasma drug concentration. And the reason is that we look at the plasma drug concentration because we assume that that plasma drug concentration is proportional to the target tissue concentration. It's the most accessible site that we have to measure, and we assume it's proportional to the target tissue concentration. And that's what's written right here. Now, there are some exceptions to this. And these are important exceptions, and they're intentional exceptions, right? If I give a drug via an inhaler, and let's say it's an anti-inflammatory drug, do I want that drug to get in the systemic circulation and, cause systemic side effects? And the answer is no. So when we give an inhaler, we might have a high target tissue concentration, but it's localized, and so the plasma concentration might not be very high, right? So an inhaler. Or, if I give a lotion. Or if I use, let's say, eye drops, right? Those are all cases when we give local administration of drugs. It obviously violates this little rule here, but by and large, for most drugs we give IV or PO. The reason we care about volume of distribution and the plasma drug concentration is because we assume it's proportional to the target tissue concentration. So if you have all these points down that we've gone through so far, let's do a couple of questions to help you remember. Okay, so volume of distribution, we're going to go from conceptual to practical now. So here's our question. We got a person, they've got bacterial pneumonia. Uh-oh, what are we going to do? So we decide to give them some erythromycin IV, and we're trying to reach a certain plasma concentration. Now, what is this plasma concentration? Well, we want to inhibit this antibiotic, or this bacteria. And so there's something called the minimum antibiotic plasma concentration. And so what this is the concentration which will inhibit bacterial growth. And we're telling you now that the concentration we want in our plasma is 20 milligrams per liter. We're also going to tell you that the volume of distribution of this drug, and I'm making this up for easy numbers right now, is 40 liters. So what should the IV dose be? So numero uno, if you have a scratch piece of paper, I write down the things that I know. Plasma concentration that I want, my desired plasma concentration, is 20 milligrams per liter, and I know the volume of distribution is 40 liters. So the first thing you should do for every problem is what? After you do this, write down concentration is equal to mass over volume. Mass is the dose, right, in milligrams. Volume of distribution, concentration here, is the plasma concentration. So what am I trying to solve for? Well, I know the volume, I know the concentration, I'm trying to find the mass. So I rearrange this equation, and I get mass is equal to concentration times volume. And I remember that mass is the amount of drug absorbed. The concentration that I'm looking at is the plasma concentration. And when I look at the plasma concentration, then the volume I use in our realistic case is the apparent volume of distribution. So the amount of drug absorbed. And so remember that if I give it IV, that's also equal to the IV dose. All right? Or the mass of the drug absorbed. So here all I have to do now is plug in my numbers. I want a plasma concentration of 20 milligrams per liter. And I know that the volume of distribution is equal to 40 liters. And I always like to write my units because it helps me cancel things out and remember, and it tells me if I'm doing this right or wrong. And so if I do this, I get an answer of 800, and the units then are milligrams, and I know that's what I'm trying to solve for, right? What should the IV dose be? Now, the reason I like this is because it's a system. It's a way to think about things. Just as equally, you could have just remembered the equation for volume of distribution, and that's what I wrote here, but I always recommend having a way to problem solve. Alright, let's do the same thing now and incorporate bioavailability, and instead of giving this drug IV, we're going to give it PO. So absorption and distribution. Now we're putting two different components of pharmacokinetics here. Same person, still has bacteria and ammonia, and now we decide to give them, instead of an IV dosage, erythromycin via an oral dosage. And so again, the minimum antibiotic concentration that we want in our plasma is 20 milligrams per liter, and the volume of distribution is 40 liters, and the oral bioavailability, which I can just write as F, is 0.25. So what should the oral dose be? So how should you solve this problem? What's the first thing you always should do? Concentration is equal to mass over volume. And then I think about what's going on here. So just like before, right, mass is equal to concentration times volume. And remember, this mass, is this the absorbed mass or the administered mass? This is the absorbed mass. And so here, remember from back when we talked about bioavailability, the mass, the actual absorbed mass, is equal to the total mass administered, aka the dose, right, PO, or IV, times the bioavailability, PO. And so I'm being specific to this problem. And so all I need to do now is just plug this into here. And so when I do that, I get the mass, the total mass administered, times the bioavailability is equal to the concentration times the volume of distribution. And so all I need to do now is divide both sides by bioavailability. And if I do that, it cancels out here, comes under here, F, and I get this equation. So remember, this guy is my dose. And here it's my dose PO. So I rearrange this, and I get the dose is equal to the concentration times the volume of distribution divided by the bioavailability. So I just plug in my numbers now, and I have 20 milligrams per liter. I multiply by a volume distribution of 400 liters. So liters cancel out. I'm left with 800 milligrams in the numerator. The bioavailability is 0.25, which is the same thing as 1/4. And remember, bioavailability has no units. And so this comes out to, multiply by the reciprocal, 3,200 milligrams, or 3.2 grams. So, really quick, if the bioavailability was 50%, what should the dose be? Good, 1,600, because it would just be 1/2 in the denominator here. So, here a lot of people say, oh, here's another equation that you should just memorize. I disagree. The two equations that we've done so far, which we can derive all these other ones, are concentration is mass over volume, and the absorbed mass is equal to the total mass administered times bioavailability. From these, you can really derive the equation for volume of distribution, for the dose you need to give, and you can include this component of bioavailability. So, if you got all this down, we have some stop, think, and repeat questions that you can do. And so do these, and then give yourself a little bit of a stretch, move your legs, and when we come back, we're going to do metabolism. I really hope to see you there. Take care.